Welcome back. A big day for Ontario. The last group of students in the province's hot zones given the green light to go back to class in person, obviously weather dependent today, as 27 regions begin to reopen. And this comes as testing and vaccinations are expected to be ramped up over the coming weeks. Premier Doug Ford joins me now live from Queen's Park as we try to unpack some of the big stories today as legislature resumes. Good morning to you, Premier.
Good morning. How are you today, Donnelly?
I'm doing all right, Premier, and this is the first time we've had a chance to talk since you become Premier. So I have a lot of questions for you, as you can imagine. So let's get right to them because our viewers have a lot for you as well. The reopening of the economy. This is very interesting in 27 regions. From the modeling that we saw on Thursday, coming out of the experts here saying that the variants are a big concern and the only way to keep them under control is to keep restrictions in place. So many are wondering, why are we reopening, and are we reopening too soon?
Well, I wouldn't call it reopening. I'd call it transitioning. And again, Toronto, Peel, and York are going to continue with a lockdown until February 22nd. We're going to be consulting with the chief medical officer and the local medical officers of the three regions to determine if they want to continue moving forward. And if they don't, they're still going to be in the gray lockdown. So we're taking this very cautiously, very slowly, and we're going to continue making sure we're cautious.
Premier, this emergency break, which allows us or the province to go a bit backward depending on the region, seeing where the case counts go. A lot of experts, again, saying that emergency break may be a bit too late. How do you respond to that, and will it be too late?
Well, I listen to the experts. I've listened to the health experts from day one. I'm going to continue listening to the health experts. We have probably close to 200 doctors on different tables, and I listen to the chief medical officer, Dr. Williams, take his advice, and then we move forward from there. But again, we're going to open up very, very cautiously, very slowly, and again, it's transitioning opposed to a full-blown opening like we had basically back in September. And I just encourage everyone to continue following the protocols and the guidelines laid out from the chief medical officer. We're doing more testing, rapid tests, than anyone in the country. I think we're doing about 1.8 million compared to the whole country combined of 1.25 million. I know the kids want to get back in school. I know the parents want the kids back in school. Because that is the safest place for the kids to make sure they're there with all the guidelines and protocols and the tests. We're doing 50,000 tests for schools, 40 a week, 40 different schools a week, and we're going to continue being very cautious.
Premier, is that enough? I'm just going through the numbers here, and as you mentioned, looking at the number of tests that are going in, 8 mobile school testing clinics prior to the 16th, of February at 8 schools. There's planning underway for testing to happen at 40 schools per week moving forward, but nothing's set in stone necessarily, and it's all asymptomatic, so it's not mandatory for everyone to do. And what we've seen in some of these pilot projects, like Thorncliffe Park Public School, asymptomatic, turning up a number of cases, dozens. So are you concerned about a possible school shutdown and moving into a potential third wave again and having to set us back?
Sure. I'm always concerned about the third wave. Again, we have to be cautious. We've ramped up the testing within the schools, over 50,000 tests. We're going to be doing a week, and if we need to ramp that up even further, we'll ramp it up. But again, with discussions that our Minister of Education's had with sick kids, they feel, the docs over there feel the safest places for the kids to get back in school. There's also the mental health challenges a lot of people are facing, a lot of students are facing. They need to get back in the classroom and learn in class. A lot of parents, they're finding it very challenging, along with the kids at home learning. And some kids pick it up like fish to a water, but some kids need that interaction. I understand it personally. I like in-class learning. Nothing's better than being in front of the teacher, in front of, along with your fellow students. That's the best way to go. And if the doctors tell me it's not safe, my number one priority, always has been, always will be, is to protect the children, protect families in this province, and I will not waver. I will not waver when it comes to spending money protecting the people of the province, and we're going to make sure we get through this.
Let's talk about our vaccination plan, and I think a lot of people are critical of it, and for good reason. One was a supply issue, but also the rollout of it, and obviously saw some tweaks to those who are 80 and over now moving into the next round of vaccinations. So that's great news. But how is that all going to work? Because it's, from my understanding, an online portal. But listen, I have loved ones who are over the age of 80 that don't have access to the internet. They're living within our communities. How are they going to get these shots that are needed?
Well, what we'll do is we'll put up a phone bank, because a lot of people over 80 aren't using the internet. But we're also going to put portals up for loved ones that have a elderly mother, elderly father, or grandparents, that they'll be able to go on the portal and sign them up. That's going to roll out over the next few weeks. But the good news is we're leading the country when it comes to the second doses into the arms of long-term care folks there. We're leading the country with 57% and overall in the entire country, but 67, or I think it's 66% of all folks in long-term care have their second doses. We have a great infrastructure set up right across the province, led by General Hilliard, who's doing a great job. All we need is the vaccines. And as soon as the vaccines get here, we're going to be putting it into people's arms. That's the biggest challenge right now, not only in Ontario, but right across the country. We need the vaccines.
Indeed we do, but I know there's also a lot of criticism around long-term care homes and whether or not we needed to get to this point. But I have 30 seconds left with you, Premier, and I do want to get this question in. Will your government reconsider paid sick leave? I know that's going to be discussed in legislature today. There's a lot of people making tough choices, having to go to work or taking time off to take a test and potentially spread within the community of COVID. Will you reconsider that?
No, I'm going to tell you why, Melanie. It wouldn't be fiscally prudent. We're about to double dip into the taxpayers' pockets when there's a program, and I don't know why people aren't talking about it. It's been around since September that I fought very hard, and the other premiers fought very hard for sick days. So you get 10 sick days. Out of the $1.1 billion the federal government has, they've only spent right across the entire country $319 million. So why would we go double dip into the pockets of the taxpayers when there's a program already in place? I've talked to both the Prime Minister and Deputy Prime Minister. They have to shorten the period until people can get money into their account in days. They already have the infrastructure set up, and maybe increase it more than $500 a week. So we're going to work with the federal government, and folks, you have sick pay already for 10 days. So I'd encourage everyone to sign up for that who are not feeling well.
Okay, Premier, I wish we had more time for you. I know you have a packed schedule. I appreciate you joining us this morning. Thank you, Premier Ford, joining live from Queen's Park.
You take care.
Appreciate it.
Thank you.
And I know our viewers are going to have a lot of questions about potential follow-up questions here. And what he mentioned there was the Canada Recovery Sickness Benefit. That's $500 over 2 weeks. And of course, critics are saying that is not enough. It's not getting into bank accounts fast enough. It does not provide job security. And again, more follow-up questions, hopefully, out of Queen's Park today. So stay with citynews.ca. We had more. We definitely had more to ask him, Frankie. What would you have asked the Premier?
Yeah. You know, I think you asked a lot of great questions over there. The vaccines is probably the one thing that's really front of mind for myself. My parents, not in their 80s and their 70s, but, you know, how quickly are we getting the vaccines? And, you know, it seems like things are slowly rolling out, and slowly. I look forward to better times, yes.
Yeah, we all do. We all do. All right, let's look ahead now. So most of the snow is over, Frankie, yes, but still dealing with some problems.